Did you know that if epilepsy is not treated well, it can bring for you serious complications which can become permanent in your life? So welcome to Mental Health and Science with Brother Enoch Francis. Today I want to look at some of the complications that people with epilepsy can get if it is not treated. Okay? So if you are still new to this channel, I request you to subscribe because it motivates me to make videos of this nature. So one of the first complications of epilepsy is depression. Okay? So you know that epilepsy can get you from anywhere. Someone can get an attack when you are in the market, you are at school, okay? You are in a congregation, you are in church, you are in a social gathering, okay? So this is a serious embarrassment because you find all people are looking at you, people are talking ill about you, about what has happened, okay? So this makes you to develop negative patterns or negative thinking ways that later on, if a person is not able to handle, they can lead to what we are calling what? Depression. Number two is the physical injuries, okay? Majority of people with untreated epilepsy, you find them having a lot of wounds in their bodies. They have a lot of scars. You can find someone is burnt the whole of this side, the face is burnt, this whole hand is burnt because of the epilepsy not being what? Being not treated. Okay? Then the next one is speech loss. You find a child who grew up normally talking, but because the epilepsy is not treated or the dosage that person is on is not able to control the attacks, you find that this person has lost speech, can no longer talk like used to what? Used to do or she used to do. Okay? Those convulsions or the epileptic attacks, the epilepsy can damage the speech center in the brain. Okay? So that you find your child who used to talk no longer talks. You find your partner who used to talk can no longer talk well because the epilepsy, they have affected a speech center in the brain. Then another complication that we can get is status epilepticus. There is a video that I made teaching health workers how to manage status epilepticus in a hospital setting. Okay? So status epilepticus is one of the complications of untreated epilepsy. Okay? And if it is not well managed, then it can lead to death of that individual. So status epilepticus is where a person convulses non-stop for a period of about 30 minutes without gaining consciousness. But some of these people in my real practice, you may find they are not convulsing non-stop. They can have maybe 1 minute break, then the attacks comes again. Okay? It takes within maybe 5 minutes, someone has got like 10 attacks or convulsions. So that's what we are calling status epilepticus. It is a medical emergency that if you don't attend to that individual, it will what? It will lead to death. So it also can come out of poor adherence to treatment. So parents, take note of that. Those people suffering from epilepsy, take note of that. And then another thing is what we call sudden unexpected death in epilepsy. Okay? You find someone who is having epilepsy just dying from nowhere. You wake up very okay and moving on well, but from one day you just find you wake up in the morning, someone has died. So that's what we are calling sudden unexpected death in epilepsy. Wherever you are watching us from, Uganda, South Africa, Kenya, UK, US, Canada, please, if you are still new to this channel, I request you to subscribe because that makes me or motivates me to make more content for you. Okay? So another thing we are talking about is the brain injury. You know, as someone keeps on falling down, hitting their head on hard floors, on the tarmac, whatever, it damages their brain. Okay? The physical structure of the brain is damaged, and even those convulsions, they affect different centers in the brain. We have talked about one of them is the speech center, or the area in the brain which controls our speech. So if epilepsy is not properly managed, it affects that speech center, that the child who is talking no longer talking or can no longer talk well. So there's brain injury. Okay? Then also, there is what we call developmental delay. So, you know, when a child is growing, it goes through stages. There's a stage where a child is supposed to crawl. There's a stage where a child is supposed to say some words. Okay? There's a stage where a child is now to start walking. Maybe at 6 months, we find a child is able to smile at someone. Maybe the child is able to say something, some sounds. Then maybe is coming to 11 months, suppose is able to say mama, what is able to understand. To understand, this is my mom, this is my what? My dad. His voice. Okay? So, but when a child is affected by epilepsy, you find that their development is delayed. Okay? You find a child who is 2 years old but is not able to understand instructions. You're not able to go to the toilet. You have to take them to the toilet. If you send them, you do for me this, they are not able to do that. So that's what we are calling developmental delay. Okay? Some of these people, when even they have grown up and they have gone to school, you may find they are not understanding like these other normal children, in that their brain has been affected like that way. So if you have people with epilepsy, they're at home, please let us give them the tasks that they can understand. Don't give them instructions which are so complex. Give them simple instructions which they can understand. And they may not understand so much well like these other children. Okay? Why? Because they have epilepsy which has not treated well and has affected their brain. Okay? And sometimes people can be on medicine, but the medicine is not controlling the attacks. So you need to get a personal doctor. You have to talk to your doctor to adjust the dosage, which can control the what? The attacks. So lastly, epilepsy can bring divorce in our homes. You find a husband and the woman separating because of epilepsy. So I have seen a lot of women being abandoned by men because they discover these people have epilepsy, and they leave them there with children, and they find them helpless. Okay? So sometimes if the men don't have the knowledge which it takes to handle a wife or a partner who has epilepsy, it can make them to divorce. Even the women themselves, if a husband is the one having epilepsy, they can run away. Because every time you are thinking this person is going to have an attack at night, what am I going to do? So if you are that kind of a person, I have videos for you on how you can handle someone who is having epilepsy, how to give first aid to someone with epilepsy, and also you have to know about epilepsy. So I have made videos specifically for you to know what epilepsy is, the causes, the things that those people are supposed to avoid. So if you have not watched them out, please watch them out. So divorce is one of the complications of epilepsy. So if you have a partner who has epilepsy, please do not separate because of epilepsy. We are saying that epilepsy can be treated. We have various medications in our hospitals. So get in touch with your doctor and let him adjust the drugs so that it can reach the level where the seizures are controlled. Okay? If you don't have a personal doctor, please, I am willing to help you. My contact is just there on YouTube. Please, we can get in touch and I can support you. So thank you so much for watching my video. If you found this helpful, please subscribe to my YouTube channel, and this motivates me to make more videos of this nature. Thank you.